Hi, I'm Adam Searing. Adam Linker and I today are here giving a quick overview of some recent developments in the healthcare policy world. Adam?
Yeah, today, as many people know, Obama announced the new leader of DHHS and also of his entire health reform sort of effort is going to be Tom Daschle.
Right, and he had a press conference about that, right?
And he had a press conference, and you might not have known that it was about health care given the focus on Illinois Governor Blagojevich, but it actually did talk some about health care.
Which was good, since I think there's a lot of fascination about Blagojevich, but
right.
Boy, the health care is a lot more relevant.
It's a lot. I think it's a lot more important. Yeah.
So what else what did he say there? Basically?
Well, he really talked about how he's going to make health care a priority. Some people have been wondering, is he going to put it off a couple years? Is he going to be able to enact health reform immediately? And he addressed that by saying that some people are asking an economic downturn, how can we have health reform? And Obama very directly said, I ask a different question, and that is, how can we afford not to?
Right.
So I think there could be changes up front. So.
Right.
And not only Daschle was introduced as a head, but he had also a deputy secretary.
Right, yeah. His deputy secretary was also introduced to Daschle's, for Daschle at DHHS. Her name is Jeanne Lambrew. Jeanne Lambrew actually has some North Carolina connections. She got her PhD in health policy here at UNC School of Public Health, my alma mater. She also worked with Jim Bernstein, who is, for many years was head of rural health here in North Carolina, did a lot of good stuff for the state of North Carolina. So she has a wealth of experience on healthcare issues and some pretty strong North Carolina connections. I think she's an absolutely excellent choice. She really understands what issues are at stake and has been very vehement in her reasoned approach to healthcare reform.
And there was, during the press conference, every reporter asked about Illinois politics instead of health care, except for the last question, which did finally ask, well, how are you going to pay for health reform?
Which is a good question.
And it is a good question, yeah. And
I think Obama was very clear that you just have to focus on cost controls. We can't afford to continue on the road that we're going on. And I think Daschle, when he was speaking, was very clear about that too. What were the main things he was talking about with controlling costs?
Some sort of research where we, known as comparative effectiveness research, where we really put our drugs, our medical devices to the test.
So what comparative effectiveness is just look at the newest, fanciest drug or medical device or test and see if it works any better and how much more does it cost than the proven treatments that you already have. That can lead to some pretty serious discussions, and they're certainly having those in England. For instance, there may be drugs that cost enormous, hundreds of thousands of dollars a year, and in England they have one health budget. If they spend more on those drugs, then they have less to spend on caring for sick kids. So they really have to balance these things out in England, and it's created quite a bit of controversy, but a lot of interest from other countries and from pretty conservative folks in the United States.
Right. This is the National Institute for Health and Clinical Excellence. They not only provide guidance for physicians, but they also have very easy to understand consumer guides. So if I have cancer or diabetes, and I'm looking for, my physician recommends some type of drug or a medical device to use in my treatment, I can just go to the NICE, as it's called, and look up their consumer information and find out, well, what are the recommended treatments? What are my options? So that you have a second opinion right there, and it breaks down the information very clearly, and you don't just have to rely on the physician. Any journalist who, when a new technology or a new drug comes out, they can go to the NICE website and actually look at and review the evidence for those drugs and see whether they're effective or not.
Okay, great. Well, I'll just close by saying and just noting that we here at the Health Access Coalition, several months ago, we actually proposed a similar institute in our affordable health plan for all North Carolinians, using some of the research universities and resources we have here in North Carolina, which would do this kind of comparative effectiveness research. So I think we're ahead of the curve.
I think so. I don't know if there's any evidence that Obama directly took his idea from our plan, but
I bet he was looking through that document, and there's no doubt in my mind that's what he was doing.
Well, I'm glad we can put some proposals on President-elect Obama's desk that could become the national model for reform.